Welcome, everyone. I'm Dr. Tim Brown. This is Pharmcast for the Community, sponsored by UGA's College of Pharmacy. Last month, we had two folks on, Dr. Hannings and Dr. Chastain, who did a great discussion about the COVID vaccine and why we should get it and how it's working for us and really where we are in the rollout, like which population should get it. But what you may not realize is for people to get that vaccine, there's so much that happens behind the scenes. And here in Georgia, we particularly have two people on today that have played a significant role in the background of how that vaccine is coming to the community, how we are seeing it spread out to all of our towns and cities. I want to introduce, first of all, Dr. Jennifer Shannon, who's the owner of Lillys Pharmacy, currently also sits on the board of the Georgia Pharmacy Association. Is that correct, Jen?
That is correct.
And is a graduate of where? Where'd you get your pharmacy degree?
The wonderful Virginia Commonwealth University.
Well, and I should let you know I did my residency at MCV, so we have that in common. See, I like that. Jen actually runs an independent pharmacy, also works with a local hospital, has been an advocate for quite some time when it comes to pharmacists giving care to patients in the communities, and spends a great deal of time volunteering and giving her time to a professional organization in our state called the Georgia Pharmacy Association, which we have Greg Reybold on board, who, if I'm not mistaken, Greg, I read today, very impressive, Vice President of Public Policy.
That's the official title, yeah.
I don't know what that means, but at the same point in time, I also know that you're an attorney, correct?
Yes, yeah. I'm Vice President of Public Policy and the General Counsel for the Pharmacy Association.
And Georgia Pharmacy Association, what is that association? So for those who aren't aware about professional organizations for pharmacists, what is different about that organization from, say, something else in the state that represents nurses or physicians or social workers?
Yeah, so Georgia Pharmacy Association represents pharmacists across practice settings throughout the state of Georgia. And so pharmacists at independent pharmacies, chain pharmacies, hospital pharmacies, long-term care pharmacies. And so, we represent the profession, broadly. And a lot of what we do is working down at the Capitol from an advocacy perspective, making sure that pharmacists' interests are being represented, and I would say just as important, and I think the Pharmacy Association does a great job of this, making sure that patients' interests are represented and looked after at the Georgia Capitol.
That's a really great point. I think when people start talking about pharmacy, and they've had a chance to meet a lot of different types of pharmacists on this show, people who work sort of everywhere, and it's Georgia Pharmacy Association, or GPhA. Actually, all those pharmacists can call you professional home. It doesn't really matter where they practice.
Right.
That's right.
It's a nice organization that everybody's included in that.
Yes.
I know also you spent a great deal of time, as you mentioned, at the Capitol talking to legislators, sort of working your way through there. And you mentioned the word advocacy, or supporting the profession of pharmacy.
Yes.
I wanted to bring you guys on the month of February. A lot of times in February, podcasts and healthcare talk about your heart, because it's Valentine's Day, but you know what? I'm not gushy that way. I'm not feeling the love in February, but I really know that February is a big time that we spend in Atlanta as pharmacists talking to legislators about what's a big deal for pharmacists, what's been coming up, and as you pointed out, really sort of fighting for the patient's rights, whether it's drug pricing or different types of drugs, or just the way pharmacists practice and give care. And I know something just came up, and that's the reason I wanted you guys to come on. Washington sort of said, I think it was 2 or 3 weeks ago, that they're going to roll the vaccine out and use community pharmacies and pharmacists to help access. How is Georgia responding to that news? I'll go with Greg first, and Jen, I'm certainly going to ask you what's happening at Lillys Pharmacy and how you're doing it. But I thought asking Greg from a standpoint of being in Atlanta at the Capitol, what have we been doing to make sure that Georgia is staying up to speed with this sort of change in plan from the new administration?
Yeah. So, and before I kind of address that, I'll backtrack a little bit. Obviously, since the onset of COVID-19, it's been a rough 12 months, I think, right? There's no question about that. But you try to look for silver linings. And I think, for the pharmacy profession in particular, pharmacists have really been looked at as a major part of the solution from the beginning of this pandemic and across administrations, which I think is unique. There's very little that the different parties agree on nowadays, but pharmacy seems to be, I joke around at the Capitol, pharmacists are the glue that's holding democracy together. It's the one thing that folks can agree on, right? And it's very much the truth, right? So the Trump administration very early on took significant action through the PrEP Act.
That's true.
You know, and their US HHS authorized pharmacists to do COVID testing very early on, and pharmacies have figured centrally in COVID testing from the outset. And then as the vaccine has rolled out, again, pharmacists have figured centrally there as well. You know, there were chain pharmacies getting the vaccine under the Trump administration, and then with Biden, you know, in his new administration, kind of rolling out this new program. I think the goal is to maybe broaden a little bit, but again, it's all about getting patients the vaccine and using some of the country's most accessible healthcare providers and highest trained healthcare providers. And so it's an exciting time from that perspective.
So just sort of go back for a second. I think, you know, your point is so well taken. I sometimes think pharmacists are the glue that hold a lot of things together, not just democracy, but even, you know, because medications are pervasive. They're everywhere.
Right.
Absolutely.
You know, and almost every healthcare profession uses, touches, prescribes medication. So the pharmacist being that expert is in that mix. I think it's interesting. You talked a bit about how pharmacists are out there. Jen, one of the things I know, you do a lot in your practice. I know that you work in a community pharmacy. You do a lot of patient care in your community pharmacy too, correct?
Correct.
Can you tell me a little bit about Lillys Pharmacy, like where it's located and kind of the things that you're doing within your store? Not necessarily with COVID, but just in general to care for your patients.
Yeah, so I'm super proud of our little engine that could. We're 7 years old. We're located in Johns Creek, and by trade, I'm an ambulatory care pharmacist. So I trained in hospitals. I worked in them when I finished my residency. And when we opened our pharmacy, I always joke with my husband, you're not going to chain this tiger behind the counter. So, but my whole goal was that I wanted to have direct patient care services. Like, you know, pharmacists now rarely touch pills half the day. We are actually like doing a lot of care coordination and a lot more point of care things for patients that don't actually involve dispensing. And so while we do have dispensing in our practice, my whole hub is my care transitions program with Emory Hospital. So we're managing complex patients every day at discharge and really doing what pharmacists should be doing it every day, right? And if we had the opportunity to not be bogged down by a lot of extra things. So we do a lot of clinical services. I'm actually ramping up a med management clinic with some of the primary care providers to close that transition of care gap from outpatient provider to pharmacy. So that we elevate our role even further.
So let's stop there, because I think all those words sound great on a resume, a grant and everything else. But to the public, what you're saying is you're helping people move from the hospital back to their home, or from their home maybe to a nurse. You're helping their medication stay straight, so there's not any errors that happen, right?
Correct. And because the reason that is so important is that patients have started to shop their drugs over time. Greg knows that I am like, you know, that makes me so sick to my core, because it doesn't allow pharmacists to practice the way we are trained when we don't see the whole picture. So that whole care transition program of just being the eyes for patients when they leave the hospital saves lives. I mean, it saves so many things on the hospital end, on the pharmacist end.
So tell me, Jen, do you also, and instead I should say Dr. Shannon, but since we're friends, I'm going to call you Jen. So Jen, you vaccines, I'm assuming that in this transition and working with people, you also have been working with vaccinating people for quite some time. What kind of vaccines have you been giving in your pharmacy over the years? I don't think people realize that pharmacists have been given vaccines for a long, long time. This did not start with the flu vaccine or COVID. We do a lot of vaccines.
This is correct. And actually, many thanks to Greg specifically and the Georgia Pharmacists Association, because they enabled us to do that even further with all the protocols that are in place now, so that we really can do all vaccines. Now, currently under our protocol, we can't do all of them without a prescription, but we do. We do Shingrix, Tdap, don't worry, with a prescription right now. All of them, influenza, pneumonia. I mean, our patients come to us first to get those. And then if something did require a prescription, they still come back to us. They'll ask their doctor, because we are so accessible. I mean, that word accessible in pharmacists those two have been together for so long, because it's true. And so the one thing I've learned in COVID is when all those doctors were closing their doors, our doors were open, you know, and we were servicing our patients. We may have been vaccinating them outside, but they were getting what they needed. And so, yeah, we've been doing vaccines for a long time.
I guess, you're right. I mean, physicians' offices kind of had a different take on because of sitting in the lobby or sitting in the waiting room, and, the traditional way of seeing someone did change a bit. And it's funny because I talked to a lot of pharmacists who kind of moved their store around to accommodate testing and making sure people had access to medications, over-the-counter medications, everything.
Right.
You mentioned, the shingles vaccine. You mentioned getting your tetanus shot at a pharmacist, the flu vaccine, pneumonia vaccine. So, Greg, it only makes sense that everyone at the administration should have said, well, a pharmacist should be doing this. Did that happen easily, or did you have to go and do a little bit of salesmanship when you were talking about Georgia in particular from GPhA?
Are you talking about like in terms of expanding now or a couple of years back?
I know you guys played a big role, but I mean, just this whole aspect with COVID and accessibility. And I think we all know that this has been difficult to get the vaccine to the public. So this is another step, but how much pushing did GPhA or you do to sort of go, listen, here are pharmacists. They already do this with everything else. This just makes common sense.
Yeah, so it's a good question. I think that, it's a dance almost, right? Pharmacists are incredibly well regarded in Georgia. And so, before the pandemic hit, pharmacists are, there are legislators and leaders in the state that know Jen well because she's down there and she's testifying, and advancing solutions for improving patient care and patient access to medications. And so I think, it's certainly a pleasure and honor representing pharmacists from the perspective of they're so well regarded. And I think it really is well recognized, a lot of the work that they do. So we're never starting from square one, right? But I think, what we found is even though sort of the federal has taken these actions and authorized pharmacists to administer vaccines under the PrEP Act, and I don't want to bog folks down, but when HHS did this authorization under the PrEP Act to allow pharmacists to administer vaccines, that's preemptory, right? And so...
Okay, you just slung a lot of multi-syllable words there. Your parents would be
Welcome.
proud of you. They paid a lot of money for that degree. So basically what you're saying is when the Trump administration told the people that oversee the health that pharmacists should be able to give vaccines, it really kind of rolled the red carpet out for pharmacists to get involved because it came from the powers that be.
It did, right? And so, when they issue an authorization under an emergency order, that has the force of preempting any sort of more restrictive state laws. And
so the states now have to sort of abide what's been rolled out at that national level, making pharmacists universally accepted in all 50 states and territories.
Theoretically, right? I mean, and that's the import of what the law does. But there are a lot of states that sort of threw up walls to that. And they said, well, wait a minute, we have state laws that are more restrictive. And so a lot of what we did is work with the state, the Department of Public Health and the governor's office, the Georgia Board of Pharmacy, and they've all been really responsive and incredibly receptive. And I think largely recognized fairly quickly that, hey, our community pharmacists are a major part of the solution. And so where some states put up walls, what we found is our Board of Pharmacy and Governor Kemp, implemented executive orders and emergency orders that sort of helped along what they did at the federal.
Sure. Yeah.
And so what we found is pharmacists have figured, it's certainly not been perfect, right? And this is a massive undertaking,
sure.
Rolling out this. And so I'm not going to sit here and say it's been perfect, but I think it's been pretty neat to see that pharmacists have been figured so centrally and part of the solution in terms of how do we get this out.
Greg, you say, it hasn't been easy, but I have to stop for a moment and say pharmacist. This happened in March of last year.
Yeah.
Not even a year yet. We have approved 2 vaccines. We've done clinical trials. We've got people on board to get it through. As you point out, there was some, I guess, overlap in administrations in like what they felt was important. And pharmacists certainly were a part of that overlap. I have never seen the system move so quickly.
No, it's true.
Think about flu vaccines. I mean, we had the same flu vaccine for years before we got anything that was kind of new out there, and the flu's been around forever.
Yeah.
So, I guess, Jen, many people will say, well, listen, this has happened really quickly. Do pharmacists have training to do this? I mean, I think Greg made a great point. Pharmacists are in there and they made this emergency order saying pharmacists should do this, but I may say, hold on. I see my pharmacist every day and he's a very, very nice man or she's a very, very nice woman. I've never thought of them as being on the cutting edge of health.
Oh my God. But but we were born for this, right? Pharmacists were made for this. You think about the training and the way we train PharmD students and what we do in our residencies, it's even so much more than this, right? So, to put a pharmacist on the forefront is genius because we're accessible, we are well trained, we are well versed in medications, we can read clinical trials like nobody else can, right? We are trained to analyze if this is good or bad, right? And to make that decision quickly. So I do think that, like, as I said, we were born and trained for this very moment. And like, I have loved every minute of watching my colleagues across the country shining, right? And they're not doing it for the credit. They're doing it because that's what they do, right? And that's what we do.
So when all the kinks are worked out, just to put the bottom line out there, when this vaccine gets to my independent pharmacy, my chain pharmacy, you're saying to the people out there, this is a great place to make your appointment if you want to get in the door. And because there's more points of care. Jenny, you've said this multiple times. Mm-hmm. There are pharmacies everywhere and only one Department of Health sometimes that services multiple counties. And those poor folks are just going crazy. And then physicians' offices, it's kind of hit or miss or who's getting it. This sounds like it's going to be, I hate to use the word universal, but let's just say it's going to be the norm to see shipments make their way to pharmacies.
Right. And I think it will be the norm here pretty soon. So I think, and I mentioned this to you, dynamite comes in small packages. My dad's been saying that a long time. Maybe it's because I'm 5 feet tall, but bigger is not always better either. And so you have these community pharmacies that are so well equipped to care for the patients that they know and love and live next to. And you look at the states that have utilized community pharmacies purely, right? And they are vaccinating like crazy. And it's so, I guess for me, it's encouraging because you see these states like and their patients getting their lives back a little bit. And so I think the more that we advocate for pharmacists to get them in their hands, not these huge stadiums where people are sleeping in their cars, like nobody wants to get healthcare in their car, right? So I think like if we open the door for pharmacists, you're going to see pharmacists putting like their feet forward a million times over, and you're going to see the communities taken care of very quickly.
And this might be a bit of a digression or not exactly on point, but when you talk about like nimble and the ability to adjust, when you look at sort of when COVID first started coming on strong, almost, other than your hospitals, almost every other provider shut down but pharmacies. And what we saw is pharmacies adjust their day-to-day practice and find a way to provide care for their patients, under incredibly trying circumstances when, a lot of other providers were just closing down. So, I think pharmacy proved to be nimble.
No, that's a good point, Greg. And I think those providers were kind of forced in that position because they didn't know what to do. And pharmacists were able to move that. I had Patrick Chansey on and he talked about how they adapted their pharmacy as well. And I think, Jen, good point. When you're a community pharmacist and you are a local pharmacist, they're your stores. You can move them and do what you want within your practice a little bit easier than maybe someone that has multiple chain pharmacy stores across the country and they're sort of waiting for the red tape. That's a really great point. I think the other thing, and Greg, you brought this up, and Jen, I want you to jump in. When you talk about advocacy and supporting the profession of pharmacy, was this one of the biggest pushes for the pharmacy profession that you've seen in your career so far? Or does this blend in with where we thought pharmacy was going all along?
To be honest, sorry if you were going to say something. To be honest, I think this blends where we're going. Pharmacists, we have been in waves, right? We started out almost like prescribers way back when. Then we brought in the soda fountains and we sort of started moving back behind the counter. Our profession is moving out front of the counter again. And there is no question about that. So I don't believe that this changed our direction. This was right along the journey we are going in the right direction, right? And Greg heard me banter about how does pharmacy get where it is? And this is the way we should be going with our patients, not away from them. So
Greg, I'm going to ask, do you think what GPhA's done put the infrastructure in place in Georgia for this to be this seamless kind of process? I mean, I know you guys have been really supporting professional pharmacy for a long time. We've talked about the other immunizations you worked on.
Yes.
But was that a building block to get to where we are today? So when this brand new thing rolled out, it made it, I don't want to say easier, but let's just say it made it seamless.
Yeah, without a doubt, right? In other words, it's an evolution, and certainly there are steps to building. And the interesting thing is pharmacy, and a lot of folks may not realize it, but I would venture to say, there's probably not a more regulated profession than pharmacy, right?
There is not.
That's fair.
At the federal level, at the state level, via laws, via regulations, via boards. And so I think absolutely, that there were steps taken in advance of this. Obviously in 2015, around 2010, pharmacists were given the authority to administer really one vaccine. And then in 2015, we expanded that to 4. And then what we found is, there were sort of some of these arcane rules and regulations that said, yeah, hey, maybe a pharmacist can do a vaccine, but the regulation said they had to stay behind the counter and have a direct line of sight to technicians at all times, right? And so we worked with the Board of Pharmacy, and the board, it was, great to work with, and kind of changing those regulations so that pharmacists could get out from behind the counter and provide that care. Right. And of course, since 2015, they've been doing, a significant number of vaccinations. And so I think really they were prepared, right? That there were processes in place, and there were policies and procedures, how to dispose of, contaminated materials, and all of that stuff was in place, and pharmacy was ready to go.
And having supplies there, right? I mean,
having supplies there, yeah.
And the fact they have to have a place for somebody to sit and for a few minutes after they have their shot, and
right.
that plays a role here, because growing up, I can't tell you that our local pharmacy necessarily had a place that allowed for that. So
right.
over the past decade, if not 2 decades, the practice site or the stores have been altered to fit this new progressive model of pharmacy. Now, Jen, you and I have something in common. I worked in family medicine. I was a family medicine provider for 25 years.
Ah.
So I worked and had a patient panel, and I gave vaccines in my office as a pharmacist. So, I think a lot of people were talking about community, and that's exactly where I think we're going to see a lot of people have access to care. But there are other pharmacists embedded in various communities, providers' offices, those kinds of aspects that I know you've advocated for as well. This is not just about one part of pharmacy; it's all pharmacists and where they live and practice. I think, sorry to interrupt you, but thank God we have Craig. I'm going to toot his horn here for a second, because he has been able, as an attorney, to eloquently describe that to legislators, and even this year, and I don't know if you remember when we were talking about it, Greg, but just about expanding our vaccine abilities, we are ready. Oftentimes physician offices don't have them. So we're going back and forth. So, at the end of the day, whatever turf wars have existed, we all need to be servicing our patients. So however that is, for me, none of that is giant revenue gaining. It's for me to be able to give a continuum of care, right? And that's all pharmacists ever want to do. There's those big words. You're not in it for the money. You're just trying to give care to everybody.
If I was in it for the money, I would have opened a donut shop a long time ago.
And I'd have the Starbucks franchise right beside your donut shop.
It's not in drugs.
So I guess, as we talk about this a little bit, I want to take a step back for a second and say, okay, Jen, you bring up a good point. Continuity of care, or trying to take care of a patient, access. We've heard a lot in the media that there are people who have what we call vaccine hesitancy, which means they're like, I'm not sure about this. Matter of fact, this morning on the local news, I watched them follow a lady as she did her research to figure out if she was going to end up getting the vaccine. She was concerned. So they sort of followed her through her process. And she was an average, everyday person who didn't work in healthcare, who was trying to figure out clinical trials and what does this mean? Tell me a bit about how pharmacists can help people in the community understand the vaccines a little bit more. I mean, I know we're talking about getting the vaccine to the pharmacy, but there are steps people can take just to learn about the vaccine before it even gets there, right?
Yes. And the thing that I always say, and it was one of my physician friends a long time ago, said, you do you, I'll do me, but don't put Google in the middle. So I think the challenge with all of this entire pandemic is that you have everybody in the healthcare knowledge pot right now, right? You have people giving their opinions. The news is constantly trying to film places to get, inciting their opinions. But But at the end of the day, we really need to rely on our trusted healthcare providers to help you navigate that information. Because if you go on the internet, like if you're self-diagnosing, whether you're researching something, it will tell you whatever you want to hear, right? But you have trained healthcare providers that spent their entire time in school learning how to evaluate clinical trials. I mean, I think back to all those biostat classes that I took where I was so bored, or my drug lit part of residency.
No,
but
I'm having flashbacks. Stop.
You're having bad memories, right? But how invaluable they are. And you don't realize that as a student until you start having to evaluate that information on your own when you get out of school or when you're in your residency. And you realize that you have to evaluate that information because you need to make sure it's safe for your patient. And so I think that that part is missing in all of this when you have the non-healthcare providers in the middle, or patients who are scared and they're just trying to absorb as much information as they can. So
Jen, I guess I would ask, do you think it's appropriate for me to walk into my pharmacy where I get things done and say, hey, can you tell me a little bit about this vaccine? Like, what do we know about, or do you have information? Do you think pharmacists would rise to that and go, yes, I'm here to give you?
I am waiting for that, because to be honest, not that many people come in and say, should I get the vaccine? But they haven't really asked, can you tell me about it, right? Or what do you know about it? And so I always say, like, people come in the pharmacy and ask, what's my copay? You know, is it covered? Did the doctor send it over? And I'll say, well, I don't know about that part, but do you want to ask me about your medication? Because I'm a ninja when it comes to that. Like, we really need to make sure we educate patients and our colleagues in healthcare. Hey, tell them to go talk to your pharmacist. Now, some pharmacists may be like, tell that Jennifer Shannon to stop talking because I'm too busy to answer questions today. But really, we are prepared and we can help people evaluate if it's the right decision for them, right?
You know, that's a great point about, and Greg, I'm going to ask you this because I think I know the answer already, but I'm going to ask it. You know, we talked about why the government looks at these points of access, community pharmacies and everything. One of the other areas, not only vaccine hesitancy, I've been hearing and I've been reading that there's just certain communities and certain groups that say, I'm not sure about this. This evens the playing field because now everyone has a pharmacy in their community. So they can seek out the vaccine or information, or heck, as Jen, just go and go, tell me about this thing.
Right.
Do you think this evens the playing field a little bit with making sure that we have equality in healthcare, like by doing it this way, by giving pharmacists this accessibility? Do you think it evens the playing field for everyone, all citizens?
Yeah, you know, I think what's fascinating is if you look, and we'll take Georgia because we're in Georgia. You know, if you look at the maps of medically underserved areas, it's vast. And, you know, it's not always in rural Georgia, right? There are medically underserved areas in the heart of Atlanta. But when you drill down in those maps, you know, one of the neat things is, you know, more often than not, you're going to find a community pharmacy there. And you know, that's certainly, you know, aside from, of course, the training and the expertise that pharmacies have, it's something that figures centrally in this, right? Whether you go to the, you know, absolutely south of Georgia or north of Georgia or the heart of Atlanta, you know, in areas where folks have a hard time getting care, pharmacists are there. Pharmacies, you know, are willing to go into those areas and provide care in those areas. And that's critical when you're trying to, you know, a mass vaccination type event like this.
Yeah, you know, I think we've always talked about, you know, here's the flu vaccine and here's this. And this is really one of those things where we're trying to reach as many people as possible. And I think, Jen, you talked about, you know, we're in that 1A right now going into 1B, 65 and older, people who work in certain areas of healthcare. Really, when this does, and I'll use the word trickle, when this does finally trickle and the distribution happens and we see the vaccine out to the far reaches, this really will ease the accessibility because I don't have to get on a bus and go across town.
Right.
I don't have to get in an Uber. I can just make it to my local pharmacy that may be just down the street or maybe less of a drive than it would be to go across town to the local hospital or Department of Health.
Right. Yeah.
Absolutely. I mean, I've been so upset because I'm hearing these stories about people driving 2 hours or getting up at 5 o'clock in the morning to make an appointment. I can't wait for pharmacists to have this everywhere because you guys are going to watch this ripple effect that's going to be awesome. And we're going to be like, we're done. We got this, you know? So I'm so encouraged about it trickling down, and we're ready, right? So,
that leads me to that, I come with the hard-hitting questions. When do you think we're going to see this into the pharmacies? I mean, like, let's face reality. You guys are both in the know. You work a lot, and I'm not going to hold you to it as much. I just kind of want an educated guess for our community to say, okay, this is not going to happen next week. Monday, we're not going to see a big But when do you think we're going to see sort of that distribution happen to community pharmacies on a large scale?
I'll answer first. So based on some of my calls and things that I've been kind of listening to, I do think in another month or so-ish that you're going to see this start coming out even more aggressively. Because here's the thing, there are pharmacies in the country that received vaccines that they weren't on the initial phase 1, right? Or phase 1A. So to me, I am encouraged about that part, that pharmacists are receiving these way earlier than they were told. And when you think about this whole thing, the fact that they're even in any pharmacies right now is amazing, or that we have a vaccine is amazing to me, So I've been trying to tell people that are just so scared and frantic, like, just be patient. I really do believe this is only another month before we see this starting to come out like wildfire. And I don't know what you think, Greg.
Yeah, I agree. I would say it's kind of hard to follow, right? But there's sort of two tracks for pharmacies to get the vaccine. They're shipping to the states, and then through the state's Department of Public Health, they're allocating vaccines, and it's a hard, tough process. Sure. But what we're seeing in Georgia already is, pharmacies that have registered with the state have received vaccines, and they've done a phenomenal job administering them, incredibly quickly and efficiently. We've got pharmacies this week that are going into Fulton County in certain underserved areas and reaching there. And then sort of the second track is the federal track, right? And I think that seems to be rolling out a little bit slower. Yeah. But I agree with Jen. I think we're going to see it in a month. And I'd also say, we're talking a lot about Georgia and the work that the Georgia Pharmacy Association does. But up in DC, we do have national organizations. The American Pharmacy Association is doing an awesome job working with both administrations.
Right. I think a lot of people, Greg, you make a really great point. We have our local, our state-run organizations, but many of them have parent organizations. You mentioned APHA, ASHP for Health System Pharmacists, right. ACCP. I mean, I don't think a lot of people realize the number of folks that we as pharmacists have representing us all over, trying really to get access to care so we can do the best we can as pharmacists, to Jen's point, and make sure we're giving what I call optimal care or amazing care to those people. So we've sort of talked about, it's coming. We're everywhere. We're the ninja. We're in the mix. So if you had to leave our community with 3 pearls about what pharmacists do and how you have helped us get to where we are today, what would you tell people about this vaccine and sort of what this means to all of us, that pharmacists now are going to be a point of access, or honestly, maybe, I'll call it first line point of access when it comes to vaccinations against this particular virus?
I guess I'll answer first. So if I was going to leave 3 things, the first thing is you really don't have to look further than your pharmacist, right? I mean, if you have a really good pharmacist, they're working with your doctor and they are your hub. And so, maybe you don't have to look much further than you thought you did. Second, your pharmacist wants to be there for you. Be there for them the same way, right? Make sure they know you and understand your disease states, and let them see the whole healthcare picture, because when you let us see everything, we thrive. And you see it in patient outcomes. And then third, if you don't have a good community pharmacist, go find yourself one, because it's life-changing, not because I'm a community pharmacist, but I think that we can really make a difference in people's health outcomes. So.
I agree. I think don't choose the store closest to you. Choose the pharmacist that you like. I mean, it's just like choosing anybody else. That's a really great. I'm not going to take my car to the mechanic next door and they be a lousy mechanic. I'm going to find the best person out there to take care.
Right.
And my body is. Yeah. I get you.
My biggest thing I tell people is you should interview your pharmacist the way you interview your physicians. You know, people spend hours canvassing which cardiologist you're going to go to, but I need my life-saving cardiovascular meds. I'm just going to drive to whatever's on the corner or wherever I can get it for free. How the heck did we get there?
No.
So
Sometimes just for fun, I call Jen's Pharmacy and I ask if they have free generics, you know, just to get her going.
very funny. I believe you get what you pay for in healthcare.
So Greg, if you had to leave 3 pearls, 'cause I know you've played a significant role in Georgia and really elevating the practice of pharmacy, but also I think making it more visible to everyone. And that's really what this podcast is about, is increasing that visibility to let people know that pharmacists will be on the forefront of this. What 3 pearls would you tell our community?
Yeah, I think I'll leave you with one, but with subsets, because I'm a lawyer and I complicate things, right?
This is not legal advice.
I
Just make
expected
sure.
no less. Subsets, Jen. He's given us subsets.
Now, disclaimer, this is not legal advice. No.
Not legal advice
Right,
ever.
right.
So look, I think the thing is there's more work to do, right? And so, you know, this is not a time for pharmacy to be complacent. I think this is a time for pharmacy to press forward. And, you know, pharmacy has figured so centrally, but, you know, we're in a period of emergency right now, and that's freed up a lot of sort of regulations at the state level and the federal level. But this state of emergency isn't going to last forever. And when that state of emergency at the federal level and the state level comes to a close, you know, there's steps we have to take forward to make sure that we don't go backwards. And so, you know, right now pharmacists do, you know, they are administering COVID vaccine, but when that period of federal emergency comes to a close, guess what? Georgia law doesn't allow pharmacists to do COVID vaccines, you know, pursuant to a protocol or without an individual prescription. And so, you know, there's work to do. And I think something that's really neat to see is at the state level, and again, there's so many healthcare issues floating around this year in the Georgia Capitol with COVID, but the Department of Public Health and the governor's office have really made a priority. They could be working on anything healthcare related in all of this, right? But what they've made a priority is to increase the ability of pharmacists to administer vaccines without a prescription.
That's great.
So we're working on that legislatively. And as a matter of fact, today our bill it passed the Senate. And so it originated in the Senate and it passed the Senate. And now it goes over to the House.
So excited.
And so we're working hard to ensure that pharmacists can continue to figure centrally in these things. The emergency is going to close, but COVID's not going anywhere. And we're going beyond COVID to, you know, to all ACIP. So think, you know, your hepatitis, your MMR, your HPV. And so we're going to be working to make that law. And so, you know, more work to do with vaccines, but not just vaccines. And I think, you know, something that Jen has touched on is, you know, the role pharmacists can play in improving patient care. And so that's something that we're going to be, you know, looking closely and working on as well. And it's not always legislative, sometimes it is, but when you look at sort of I hate to use this word, but the great diseases of our time, right? The chronic illnesses that plague us. And, you know, Jen and I talk a lot about this, but pharmacists have the training, the expertise, and the accessibility to beat those diseases. Right. And to manage those diseases. Oh. And so, you know, what I would leave anybody interested with is there's more work to do. And this is the time to push forward and stay vigilant and keep working. And I think if COVID has taught us anything, it's that pharmacists are equipped and trained and accessible to be the healthcare solution. And so, you know, what we'll do at the Georgia Pharmacy Association is keep working to ensure that the state knows that. Stakeholders know that, and, you know, and keep making sure that pharmacists are positioned to be able to do that in the future.
Wonderful. And making sure our community knows that every time you come on this podcast, right?
Absolutely.
Guys,
we have to do this again. It's fun.
I told you. I mean, I'm fun. This is not stressful. This is a good time.
Are you hinting around that you want co-hosts? Is that what I'm hearing? Or
we would be so fun.
We'll do. Yeah, I'm not sure I'm sure my guest will get a word in edgewise with the 3 of us, though, if we had somebody else on. Hey, but, you know, I want to say thank you to both of you, because to me, this is something we don't get a chance to do often, which is talk about how pharmacists are working behind the scenes with those folks in professional organizations and those folks who really support us, like Greg's at the Capitol all the time and really
phenomenal.
to talk the profession through. So I want to say thank you guys again for coming on. I have Jennifer Shannon and Greg Reybold both coming to us talking about how pharmacists are being supported and also how that's rolling or trickling out when it comes to COVID and your access to the vaccine, because we are going to see it in community pharmacies. Before I go, though, I want to remind everybody next month in March, talking about those diseases, those great diseases that Greg talked about, diabetes care or the medications to manage diabetes have changed in the last year. The clinical trials are showing us more and more about special drugs and how we should use them. I have Dr. Charmone Osei coming on next month. She's going to talk about what those clinical trials talk about. We're going to put them in a context that you can understand as a community, and also hopefully be able to talk to those who prescribe those medications and sort of guide that therapy a little bit for you. Until then, I'm Dr. Tim Brown. This has been PharmCast for the community. And as always, go in good health. Thank you for joining us.